All right. Well, thank you very much. Thank you to Robert Johnson for having me here today. I just say that for those of you who aren't in the room, we're in a train station, and every few minutes a train comes in and kind of rumbles and the floor shakes. And I'm from California, so I'm going to try to fight my urge to dive under the desk. But if I do that, that's why. And one thing I should say, I'm speaking here today, these views are my own, and they don't reflect the views of the Federal Reserve Bank of San Francisco or the Federal Reserve System. And one thing I would like to, for those of you who can't see these images behind us, I would like to draw your attention to them as I make these remarks, because I'm talking about community development, which is often a kind of a difficult term. It's not that descriptive, but this is quite descriptive. In fact, if you look at a lot of what community development does is to finance high-quality child care and affordable housing with that service enriched. And Nancy has a portfolio of about $1 billion of these kinds of investments. And so if you can be thinking about these photographs as we talk, that'd be helpful. Well, one thing I have to really thank the Commission for is really bringing home this idea that your zip code is as important or more important than your genetic code for your health. That was mentioned in the last panel. And those of us who do community development or community revitalization of low-income areas, we think of ourselves as being in the zip code improving business. And so we see a real natural connection between the work of the Commission and those who are working in public health and population health, and those of us who are working in community development. And this is actually reaching high levels of interest in our organization and with the Robert Wood Johnson Foundation. So I'm going to read two quick quotes here. One is from Chairman Ben Bernanke from a speech he gave just 2 months ago. He says, perhaps one of the most promising new partners in community development is the healthcare sector. Factors such as education attainment, income, access to healthy food, and the safety of a neighborhood tend to correlate with individual health outcomes in that neighborhood. Because these factors are linked to economic health as well as physical health, healthcare professionals and community development organizations are seeing new opportunities for cooperation in low-income communities. And Risa Lovizo-Moore wrote a chapter in a book that Nancy's organization, Nancy Andrews, and the Low-Income Investment Fund partnered with us, the Federal Reserve Bank of San Francisco. The book's called Investing in What Works for America. And Risa wrote a chapter, and she concluded it this way. She says, I envision a time in the near future when our fields, community development and health, and the people who work in them do not need to make a special effort to develop partnerships because we will be working side by side in communities, in states, and nationally with common aims, combining our best assets and skills to improve the lives of all Americans. In fact, we are likely to look back on this time and wonder why community development and health were ever separate industries. So it's pretty powerful. I think these ideas are really convincing that these fields should merge in some significant way. And we've tried to sort of actualize that by having these series of meetings. And David Williams suggested we had those 10 meetings, but if you count the follow-on meetings and the 2 national meetings we had here in Washington, D.C., we really up to about 15 meetings. And these meetings are like nothing I've ever experienced in all the 25 years I've worked in community development. It's really electric to get these groups together. And one way we often start those meetings is we use heat maps to sort of identify areas of concern for these 2 different communities who don't know each other, right? And so in my testimony white paper, I put in a copy of these heat maps that were produced for us by the Los Angeles County Department of Public Health. And these heat maps, they highlight areas of concern with hotter colors. So oranges and reds are areas of concern. The cooler colors, blues and greens, are areas of not as much concern. And if you look at something that we care about in community development, like poverty, overcrowding in housing, unemployment, certain neighborhoods will light up. And if you look at the areas that that health is concerned about, maybe the prevalence of childhood obesity, certain neighborhoods light up. And in every community, in every one of those 15 meetings, what you find is those 2 maps are basically the same map. And what we find is we're working side by side, but we don't know each other, and we're trying to change that. So let me give you just a very brief overview of the community development industry. Community development is an enterprise in which public, private, and not-for-profit organizations work to strengthen the economic, physical, and social environments of low-income neighborhoods. The Community Development Network builds affordable housing that often includes social services on site. I'll give you Exhibit A here. Fosters small business development and financing buildings that address specific community needs such as child care centers, grocery stores, assisted living facilities, health clinics, and charter schools. Although the emphasis is on developing physical capital, primarily real estate, community development efforts also strengthen the social bonds within communities. They do so by involving residents in the conceptualizing, designing, building, and operating of these projects. In other words, building brick and mortar structures also helps build the community in a larger sense. And Nancy's going to talk to you a little bit later about some of those examples that she's financed. Now, the Community Reinvestment Act was passed by Congress in 1977, created the foundation in many ways of the community development finance system by requiring banks to meet the credit needs of low and moderate income communities where they do business. Although the exact amount of capital motivated by this law is hard to measure, estimates are in the range of many tens of billions of dollars, and that taken together with the government, philanthropic, and market capital that goes towards this work puts the community development industry at about at least over $100 billion a year revitalizing low-income neighborhoods. The funding is flexible and has been used to support job training profits like Homeboy Industries that Risa mentioned earlier, whole neighborhood rebuilds like Purpose-Built Community, represented by Shirley Franklin here on this panel on the commission, and small business development such as Revolution Foods, which is an organization that provides locally sourced organic school lunches for low-income kids. And so the point I'm trying to make here is that community development is often the enabler, the financier, the entity behind many of our most effective anti-poverty efforts. Now, we're sort of in a crisis and opportunity moment, I think, where urban renewal policies in the past have lasted a few years until scandal political winds shifted and the programs were ended. But since the 1980s, the community development industry has had uninterrupted run and has achieved many significant accomplishments. And yet the problems that we care about, poverty, overcrowded housing, unemployment, are still too common. And community development is winning battles but losing the war, and that has really forced our sector to look for new ideas, new partners, new resources. What has become clear is that the community development interventions alone are not sufficient to address the multiple needs of low-income people in their communities. And fortunately, there are several examples for more comprehensive place-based interventions that are showing signs of success. And we highlight several of those in this book that I mentioned that Nancy helped us produce. And you know, Purpose-Built Community is one example, but there are many others. We can think of Magnolia Place in Los Angeles, Neighborhood Centers, Inc. in Houston, and many others. I don't have time to go into the details of those different interventions, but they all have something in common, which is that they're all place-based, they're comprehensive, and they involve multiple sectors. They're cross-sector in their implementation. And in many ways, it's the Commission's work that gave us on social determinants and making that to bring that to a larger audience that has given us in the community development field an intellectual framework to understand the value of these types of successful cross-sector interventions. In its simplest form, the upstream social determinants that affect health stem from well-being, and nobody, no entity or institution, owns well-being. This helps us break down the silos that currently separate community development and health, but separates us also from education, public safety, and other essential social services. So what's next? Well, we have these meetings, and one of the challenges, and this is going to sound silly a little bit, but it's just even the language of talking to each other is hard. We often say, those of us in community development say, we refer to CDC, and that to us means community development corporations, but the health people think of someplace in Atlanta, right? And so it's very confusing that way, and there are many, many examples of that. I think Jack the other day was at one of the meetings and said, someone had mentioned MRI, and he says, I don't think they know what that means. And they were referring to mission-related investments from a foundation. And the other piece is the business model. You saw Paula's slides there about, you know, sort of allostatic load and cortisol and all the rest. That's complicated. And our funding is complicated. Our work is complicated also. If you see this looks simple, but I guarantee there's 15 sources of financing on that project. It's very complicated. So understanding each other's business models is really difficult. But in spite of these challenges, there are a number of sort of efforts that are pointing to the merger of these fields. There's some real revolution in areas in finance, in policy, and in data and metrics that is kind of making this merger happen more effectively. I don't have time to go into a lot of these, but I'm going to just mention, I'm going to highlight a couple just to give you a sense of it. One is the new financing vehicle called the Healthy Futures Fund, developed by Morgan Stanley, Kresge Foundation, and Local Initiative Support Corporation. It's a $100 million fund to finance clinics and affordable housing that also promotes social determinants of health. In other words, a clinic can get discounted financing if it can demonstrate that it's more than exam rooms. It must show that it has adopted the whole neighborhood as its patient. Here's just one example of sort of the money sort of creating incentive to integrate these two fields. And then in another arena, policy is doing this as well. So the Commission toured a Promised Neighborhoods program that's trying to create cross-sector approaches to some of the federal programs. There's also Choice Neighborhoods, Sustainable Communities, these other programs. But I wanted to highlight that this is also happening at the local level. Los Angeles County recently adopted a consolidated approach to its anti-poverty and crime reduction efforts. The plan specifically calls for a multifaceted approach to build, quote, build healthy communities by integrating community, economic, and housing development investments with transit opportunities to increase their positive impact on neighborhoods. And Mayor Villaraigosa created a new housing and community development cabinet with representatives from housing, transportation, health, family services, and economic development. And the cabinet will identify neighborhoods of need and coordinate some of these cross-silo investments. And so it's very exciting in terms of what's happening and trying to bring these two fields together. And I'm just want to conclude quickly here with a observation from Ben Bernanke. This is he was recently at a congressional monetary policy hearing, and he says, quote, if talented people don't have the ability to move up and get a good education, move into the middle class, that's a loss for everyone, not just those individuals. He went on to say, I think a society in which there's greater equality of opportunity will be a more productive and efficient society as well. You know, making these changes that bring together these approaches, community development and health, is important for the health and well-being for low-income Americans, but it's also important for the health and well-being of American companies and the economy, and it's important in our larger effort to create a fair, healthier, and more prosperous society. And thank you very much for the opportunity to talk to you, and I'm looking forward to your questions.